Hi everyone, I'm Dr. Melissa and I'm a physician in family medicine, lifestyle medicine, and primary care psychiatry. I'm so happy that you showed up for this free webinar. Come on in, let's learn together. Let's take some time in your day to learn, to breathe, and understand what it means to have whole health. So I'm going to be discussing manifest health and the steps and my secrets and tips for you to find your wholeness. So let me just ask you some questions. First of all, how do you define health? This is an important question I like to ask because everyone has their point of view on health. Sometimes people base it on how they feel, how they look, what people tell them, what their doctors have told them, their labs, their diagnosis. But really, I challenge you to look beyond that. Look beyond what you may feel and know, but also embrace the possibilities of what full, complete health looks like. So let me just tell you about myself. I know you came and showed up on this special day because you care about your health. And I know I have a special connection with you because you are interested in what health is. And I would say I was too. I was searching as a doctor. I went through medical training. I actually first started in psychology. I wanted to understand human behaviors. I wanted to understand why we think, feel, and act the way we do. And I also wanted to incorporate that into medicine. But I also wanted to find the root cause of disease. And little did I know it was lacking. I didn't get much of it. I probably remember 10, 30 minutes of understanding a little bit about nutrition. It was very, very basic. All I learned about was protein, carbs, and maybe about body weight. And it was very simple and not necessarily applicable to people, especially when it comes to food as nutrition. So me as someone training in medicine, I knew that I had to search in the research, in the science. Luckily, I trained at Loma Linda University where I found lifestyle medicine, and that really opened my eyes to bigger research and also how it helped me incorporate it for myself. I was not only a doctor, but a patient. I was someone who experienced irritable bowel syndrome, which is very complex and also frustrating and annoying when you're having bouts of bloating and loose stools and you don't understand your reflux. And that was me. And I had those symptoms. It was affecting my concentration, my energy, my mood. I was feeling off. Yes, of course, medicine is stressful in the path there, but I couldn't find that key to get me to my fullest health. And when I incorporated more of my plant-based living, learn how to stress less and meditate, it was really eye-opening for me because for the first time, I had an answer. To be honest, with irritable bowel syndrome, it is a diagnosis of exclusion. So you would go through so many tests to make sure it's not celiac disease. You make sure it's not anemia or inflammatory bowel disease. And there's a lot of medications out there that can help irritable bowel syndrome. And so I was so happy when that helped me. And that is the driving force. If you saw me before, I was a bit having extra weight. I also had poor eating habits. I ate basically every type of animal. I also had acne, but now I feel not only do I have my wholeness and have barely any symptoms anymore or need for medications, I'm just grateful to share not only my story, but the science and have you apply it in your daily life. So let's think about this. You may have thought to yourself, maybe wrote it down to describe what you thought health is. And really, it's not just the physical health, not just what you see in the mirror. Sometimes it's people see it on their face or they have it in their gut or literally they get abnormal labs. And that's very, very important. At the same time, our mental health is important. How we are resilient we are when there's a stressful situation, if we are overwhelmed frequently, or if we feel ourselves unmotivated or depressed. Sometimes we just don't feel ourselves. And, some people can call it brain fog, other people can call it their memories off, but everyone is different each stage of their life. But we don't want to neglect the deep connection between physical health and mental health. And that's it, even, I would say, the brain gut connection. So when we think about our gut health, there's definitely the foods we consume can affect how we think. For example, we have our nervous system, our hormones, our neurotransmitters in our gut, a majority of them, up to 90%, and it talks to our brain. So definitely there's a brain connection, but also a social spiritual connection. So these are the things you might not be able to see with your own eyes. That's so complex, but you have this intuition that something is off. For example, if you have a loved one, your daughter or your dog, and you just notice, wow, they're really off today. They seem not themselves. They may seem sad, or they're just not with it. Most of the time, it's because of that intuition we have. When we're thinking about social health, I would say from this pandemic, sadly, we've noticed many people struggle with loneliness, social distancing. It's so prevalent. The older we get, unfortunately, geriatric populations suffer up to 50 to 60% of feeling lonely, and that's a pandemic in itself. We thrive in group setting. We thrive when we're feeling connected to our friends and family, and I would say that is definitely one of those things we don't not want to neglect. And then spiritual health. Some people believe in the universe. Some people go and refer to the guy upstairs or God. I would say that in a sense is a way for us to have that opportunity to unburden ourselves of troubles and worries and stress by having that inner peace and having that sense of relaxation, but more so hope and optimism, because it's not forever, and we can just appreciate the present and be mindful for the things we have. Now, so this mind body connection is real, as I mentioned, incorporates all three. We've seen in science and research that all aspects of our lives, including what we eat, how we move, that means physical activity, stress levels, sleeping habits, if it's restorative or if it's disruptive, our relationships with others can either positively or negatively influence our health and mental health. So it's very important to manage and our stress levels and find ways to balance these factors to achieve and maintain a healthy lifestyle. So let's say that slower, right? We need to balance and find what it means to have those healthy habits. So let me ask you, what do you want today? What do you really, really want? Think about it. Is it something that you may wake up or go to bed thinking about? I want this for myself. I want this for my health. I may, no matter how old you are, we may think of what we want to become in terms of health. And why do you want this? So you can think this through, write it down tonight or right now. Why do you want this? Is this because you want to be around for your family and friends? Is it because you want to be strong and healthy and happy? Because you just want that life? Because you see so much distress around you? Or is it because you want to be present and be the best you can in your workplace or at school? And then what do you need to say no to today? I know that's a hard, direct question, but there are things that are distracting us. There are things that are pulling us down that can be very toxic and overwhelming and causes stress. And maybe we need to say no to that right now, because we need to focus on this talk. We need to be able to implement these behaviors. And so find things, not even big things or people. It's really those no habits, saying no, turning down even distractions in your present being. So we definitely have a problem. Depression is very, very real. It's one of those things, it's doubled over the years. 350 million people have depression worldwide. And depression is the leading cause of disability. So we know that not every family member or culture or even religion out there is comfortable talking about mental health. Over centuries and years, there's been this stigma, and they've actually put them and isolated them in silos and found ways to torture them. And that was the old medicine, because they had no idea that there was actually a science connection to our behaviors and our thoughts. But now our society has science and research, and we've developed this compassion and real need that we have to talk about depression. And that's the second most common cause of death in people are actually in 15 to 17-year-olds. Unfortunately, it's suicide. So I'm all about suicide prevention. Just like we want to prevent patients from getting heart attack and cancer and strokes, we definitely, in our ERs and hospitals, a lot of people are suffering from mental health conditions where it's so unstable that they have to be hospitalized and monitored and been given medications. Hopefully, I don't want that to be you. Even if you had it, we don't want that to happen again. We definitely want to catch things early and prevent those. And so 50 million adults in the US have a mental illness disorder, and 1 in 12 people report serious suicide ideation. So a lot of people are thinking about ending their life, and we want to be able to catch that. And then 57% of people do not receive mental health treatment. Why is that? Number one, it's often diagnosed too late or underdiagnosed because they're not seeking care, or the healthcare system is not catching it early. And then other times people just don't want to take those medications. And I completely understand, right? There are times where these medications can alter our mood and our symptoms, and it takes time to get that effect. And I would say, medical disclaimer, this whole talk is for educational purposes only. I do not give specific medical advice, and do not want you to steer away from your present medical doctor's recommendations. And of course, if you have medical concerns, please reach out to me through a medical consult so I can guide you properly. And when it comes to bridging the gap between mental and physical health, studies have shown that this can impair physical health and immune functioning. So there is a deep connection between our immune health. Not only does the immune system live in our gut, there's one cell layer thin that helps us regulate our whole organs, and that is a place where we need to secure our immune system by not only eating healthy, but also knowing that there's a deep connection. For example, when you're stressed out and overwhelmed, most of the time people struggle and get bloating and loose stools, or they might even not have appetite. They might not feel motivated to eat, and they just keep moving, keep working, but they're not actually healthy. So we really need to bridge the gap between mental and physical health. We really need to understand that it's not just the diagnosis of depression and anxiety. It's actually the core of us, how we're feeling, how we are viewing our life. And individuals diagnosed with mental illness tend to have higher rates of morbidity and mortality. What does that mean? Unfortunately, people who suffer from depression and anxiety have higher rates of having other chronic diseases like depression, not just depression, but diabetes, cholesterol issues, cancer, heart disease, and then also have lower lifespans. So those with mental illness are unlikely to practice healthy lifestyle behaviors. So that's key, right? If we have a healthy mind, we also are likely to make wiser decisions when it comes to a lifestyle. And so we want to make sure that we can decrease our risk for disease. So if you're people with mental illness have just trouble. They have trouble sleeping. They have trouble even washing their face and waking up in the morning. Sometimes people who are depressed end up overeating, sleeping too much, and aren't able to do basic hygiene. And then most of the time they just stay stuck to their bed, or just not wanting to go out to exercise, and they're eating unhealthy. And then there is a big portion of people with depression, anxiety who have increased habits for smoking and alcohol use. And then studies have shown that stress can decrease immune functioning. So just as I've mentioned, that can also give them more vulnerability for having viral infections, bacterial infections. And so if you haven't noticed, when you go, even have, for example, students, they'll go on their finals week and they might be okay, but as soon as they finish the finals week, because of the high stress, they'll end up catching a cold or a cough. Or when you go on vacation, you might be lacking sleep, not eating the best, even though it's a positive thing to go away. But when you're traveling, not only your immune system is compromised, but you end up getting sick, some type of common cold. So be wary. And then when we have better physical health, we definitely can have an improved mental health. It works hand in hand. It's definitely bi-directional. So our physical and mental health are more connected than you may realize. When you implement simple and sustainable lifestyle behaviors, you can see major improvements in your overall health and wellness. So think about this. Think of your current lifestyle behaviors, the things that you do on a daily basis, what you're eating, your snacks, the foods you're eating, how much sleep you're getting, if you're getting some exercise, and think about what can you think that you may need to improve? Can you improve those lifestyles? And can you reach towards a different health goal? So let's just talk about these fast facts. I just want to shed light because this is real. There are a lot of chronic diseases Americans are facing. They even say by the CDC, 4 in 10 people have some type of chronic disease. So that's a really high number. And so heart disease is the leading cause of death for men and women in the United States. The most common heart disease is coronary artery disease. So that means the blockage uh, in your coronary arteries. That's the blood vessels that supply the heart, and those are basically what keeps us alive. So in those arteries, people think it's just clots and I would say plaque. And yes, those are key, but also inflammation. Altogether, that increases our risk of a heart attack or even atrial fibrillation or some type of heart defect in the adult years. So 18.2 million adults 20 years and older have coronary artery disease. That is huge, right? And people are getting it early and earlier. Stroke is the fifth leading cause of death in the United States. So stroke is when you lack oxygen to your brain, and that is essentially can paralyze you. You can have long-term weakness. You're unable to walk, maybe difficulty walking, swallowing. Those are those sad, I would say, outcomes that we see in the hospital and rehab. The key risk factors for both heart disease and stroke are hypertension, high LDL, and which is your bad cholesterol, and diabetes and smoking. So we definitely want to take a couple steps back, not only have a better lifestyle, but make sure your blood pressure is well regulated. Make sure you get screened for cholesterol and regularly, and diabetes too. Even if you have pre-diabetes, that's a risk factor. So that we want to be mindful and definitely want to stop smoking. If you are someone who needs help with that, I'm definitely someone who helps people get off their habits, their bad habits, especially smoking. Rates in hypertension and high cholesterol are higher in adults with obesity compared to adults who are at a healthy weight. So what does that mean? Weight does matter. So, unlike what we see around us, it seems like almost everyone is overweight and obese, and that's normal. It's actually not normal because that's where we have the inflammation. That's what stores it. And that usually ends up with chronic disease. And looking at the statistics, CDC states that in 2017 to the 2018, 73.6% of adults 20 years old and older were either overweight or obese. So this means that there is such a high prevalence in different age groups. It's about some statistics say up to 1 in 3, 2 in 3 people are overweight or obese in America. And well-resourced countries. So then looking at the different age groups, it's high, right? 40% in 20 to 39-year-olds, 44.8% in ages 40 to 59-year-olds, and 42.8% of adults 60 and older. So obesity prevalence within children and adults are really high. Sadly, it's becoming more common. 21% in 12 to 19-year-olds, 20.3% in 6 to 11, and 13.4 in 2 to 5. Can you imagine little preschoolers getting overweight and obese, and having these increased risks for chronic disease early in life, such as diabetes and cholesterol issues and heart disease? There's something we need to do differently. I look at the statistics, I look at the hospital. It's really a revolving of door. People are getting sicker and sicker. And yes, we have novel medications and interventions and procedures that help save lives. But at the same time, the chronic, lifelong, silent killers of America are things like high blood pressure, diabetes, and weight. Um, and so diabetes is important. About 11% of Americans have either type 1 or type 2. This is a high number. 35% of American adults have prediabetes. So that means our body is just struggling to lower its sugar. And you might have symptoms of, for example, increased thirst, wanting to pee often, and your sugars might be really high and irregular. And then 90% of adults with diabetes are also overweight and obese. And so we need to be mindful of this once again, because not only does overweight and obese is an issue, but that often leads to diabetes. And then 210 children, so 210,000 children and adolescents also have diabetes. Can you, once again, this is becoming a pandemic in itself. This is before COVID. We're having a pandemic of chronic disease. 187,000 of them are patients with type 1 type 1 diabetes. And then 2016, 6% of women who gave birth in the US had gestational diabetes. So young women who are bearing their children are struggling with sugars and then also passing it down, because of the unhealthy inflammatory state in their womb. Now, looking at cancer, that is always the C, right? The C word. It's the scary word that now almost someone, you look around, you might have a friend or family member who has cancer in the past or even recently, and that's what's taking our loved ones. And so, according to the CDC, colorectal cancer is the third most common cancer in both men and women. Actually, they're saying studies now it's the second most common cause in women, so we have to be very careful. Why is this important? Because colon cancer is not only linked to digestion and breaking down food, it absorbs the food, and there's a gut health aspect to it, but it's food actually goes to our gut. It's the direct contact of what we eat. So our food is supplying every single cell in our body. And especially the colon is the cleaner of our body. And whatever it takes, it also tends to digest and clean up. And it has a lot of cleaning to do. When the foods become so toxic and poisonous to our gut and our health, it develops these cellular changes at a microscopic level, and that causes inflammation and develops polyps, which can actually develop the colon mass and colon cancer. So we have to be very mindful of what we're consuming on a daily basis. In American, 1 in 20 develop colon or rectal cancer in their lifetime. That's very high. Imagine this webinar, there's 20 plus people watching, or I know 100 people signed up, but you know that that's a big amount of people struggling with cancer. The data also shows that there are 1.3 million people currently living with colorectal cancer. So yes, the treatment can be chemo or taking a portion of your colon out, but sadly, that colon is not no longer natural anymore, right? People are having symptoms that are intolerable and can shorten our lifespan. For 2021, it is estimated that there will be around 28 281,000 cases or more of new cases of invasive breast cancer diagnosed in women. There's invasive, there's ductal, there's so many types of breast cancer out there, and it's becoming more common, even in early ages. So I'm seeing so many patients, even with both breast cancer, prostate cancer, mainly breast cancer and colon cancer, have it earlier in life, in their 30s and 40s, and sometimes even their 20s. So be careful. The incidence and mortality for any cancer type is highest amongst those of 65. So yes, even though we see a lot of cancer in the older age groups, it's becoming more prevalent in the younger age groups. Fast facts. Autoimmune disease is once again very, very important, because not only is it the mystery disease, doctors cannot figure it out. Usually when they see their primary care, the doctor, it is on the last of their differential. They kind of eliminate most common and then think about autoimmune disease. I have my husband who's a rheumatologist, and he is someone who thinks about it all the time. And because of him, I think about it all the time. He also had autoimmune disease himself, and I convinced him to change his healthy lifestyle, and that's why he's better. So when you think about the US, about 1.3 million adults have rheumatoid arthritis, which is very high. That's when people have crippling joints. They're to the point where they have joint pain, joint stiffness. They might even have some rashes. Lupus is very different too, because it not only affects their joints and muscles, it can affect their eyes, their kidneys, their heart. And really the most common cause of death from lupus is heart disease. And so 32,000 people in the US have lupus, and it's growing. These are numbers that are rising, and there's many other forms of autoimmune disease. For example, vasculitis, spondyloarthritis, even fibromyalgia. And when we think about spondyloarthritis, there's something called axial, which is the spine when people have low back pain. And so that's estimated to reach 1.7 to 2.7 million people. As I mentioned before, autoimmune disease is very prevalent in a way where it affects different parts of our body, because there is an immune system that travels. All the cytokines and signals talk to all the cells. And studies do show that, yes, there's a big genetic component, maybe 20 to 30% in markers that my husband would track. And then there's the white blood cells. And so we need that to make sure that's strong and sufficient for our body. And then there's a lifestyle component. So definitely they say up to 70-80% based on research impacts our lifestyle. So meaning, if looking at autoimmune disease, 30% is maybe genetic and environmental, and the other percent is lifestyle. Our hormones do influence our immune flares. So I have patients who have rheumatoid arthritis, and when they're on their period or where they're going on menopause, they have worse flares. And then environmental factors. Environment is very important. We have toxins, lead, mercury, aluminum, PCBs, so many things that impact our health. If it's the pollution or the water or the plastics, it's really impacting our health. And those increase the risk for things like multiple sclerosis and SLE, which is lupus, rheumatoid arthritis. And sadly, that can cause things like myocarditis, skin rash, impaired vision, pulmonary fibrosis, which is when the lungs become so scarred, it's difficult to breathe, and then joint pain. Other fast facts, we have seen COVID-19 just sweep through our world, and we know that the age groups of those who suffer from COVID are very early, as young as in their teens. Yes, kids can have it too, 20s to 40s. You can see that 40s to 50s, 60s, plus 70s, 80s. And then the people who are more hospitalized are those young, even 20 and 30-year-olds. That's not that old, right? So there's a 14% likelihood of hospitalizations, ICU admissions during the, even the newer pandemics or the newer COVID variants, especially the Delta. And so, depending on what time you're watching this, these statistics definitely may have been updated. And when we look at these things, the pandemic has really caused symptoms of depression, anxiety. These are really high. You look just in January of 2019, it was 8.2% for anxiety. Then it went to 28.2 and then 36.9. Wow, of course, there's so much anxiety of the things unknown, of fear of death, fear of all the chaos in our world. And then let's look at the depression symptoms. It went up from 6 to 24 to 30%. And then both combined went all the way up from 11 to 42. So it's climbing. We know even after COVID, people having post-COVID symptoms, which I help at my clinic, people are still struggling from brain fog, mood disruptions, GI, stomach issues, and pains. We know also from the pandemic, the flip side, that having better sugar levels decreases our risk from other deadly diseases such as COVID. And then that really the poor nutrition and irregular sugars can cause more complications of COVID, because the root cause is the diabetes itself, is the poor regulated inflammation. And we got to find it out even deeper, right? It's usually the lifestyle. And then, as we know, that 42.4% in our world struggle with obesity, and those are the high numbers that actually suffered from COVID. So, if you look back at my previous slide, about up to 70% has obesity or overweight, but those who actually got COVID and died from COVID are typically those who were obese. So 42.4%, and severely obese is a big factor there too. How does diet and lifestyle impact your health? So it's everything. I focus on lifestyle because that's what we do on a daily basis. It affects our weight, our blood pressure, our diabetes risk, cholesterol, even asthma, COPD, acne, even autoimmune disease. And then those develop things like heart disease, stroke, cancer, or even COVID. So, what is lifestyle medicine? I got extra training, did a fellowship at Loma Linda, and I'm a board director of American College of Lifestyle Medicine. And I really promote plant-based nutrition. Plant-based nutrition is a way where we can get the fiber, antioxidants, all the nutrients that stabilize our gut, our brain, and also decrease our risk for things like cancer and stroke. And so we look at that, and then I also encourage stress management and just finding our sense of peace and positivity. And then routine exercise is very important. Having restorative sleep, people are lacking these things because they are either overworking or they're just worried about life. And then smoking cessation and avoidance of substance use is critically important because those are direct poisons to our body. So let's think about the big picture. Diet-related disease and mortality continue to rise because of poor diets, and that results into 1 in 4 deaths globally. Wow, that's 26% of our current reasons why people are dying is because it's diet-related disease. Mediterranean diet. So the Mediterranean diet refers to the diet of olive growing regions of the Mediterranean. And they emphasize salads, legumes, wheat, fruits, nuts, and garlic. And there are different countries in the world that say they're Mediterranean, right? Especially when it comes to Italy, they have a lot of pasta. Spain has a lot of fish in their diet, and they all have different health outcomes. So it's kind of challenging to look at the data when it comes to nutrition, but also you have to make sure you're isolating their specific foods that they're eating. So I would say they actually consume high amounts of fat. Total fat was 30 to 40% of total energy. However, the American Heart Association recommends less than 10%, and that's because of the high oils and pastas. So just know that the the oils are not necessarily good for you. Maybe the pure olive is better, but not the oils. And then multiple studies examining various aspects of the Mediterranean diet looked at this over the past 20 years, and they have demonstrated positive protective effects for heart disease, stroke, cancer, and cognitive function. So that means even dementia and Alzheimer's, Parkinson's. When you eat more of a plant centered diet, such as the Mediterranean diet, that can improve your risk factors. In 2015, there was a study that just looked in the details of the Mediterranean diet. At that time, they were eating 3 to 9 servings of vegetables daily, a half and 2 servings of fruit daily, which I don't, that's great and that's a good start, but I would say that's not enough. I'll go through that as we talk today. 1 to 13 servings of cereals, and that can be either processed or whole grains that they were eating, up to 8 servings of olive oil daily, and then nuts and seeds. The energy, fat, and fiber content were as follows. So 37% of total fat, I would say, is very high, right? Once again, we want to make sure that's less than 10%, but they did do good with 33 grams of fiber, and that's probably because of the vegetables and the whole grains. When we look at the daily requirements of fiber, the recommendations are actually at least 30 grams a day. And most of Americans, they say only 3% of Americans are having the recommended fiber amount. So when we want to discuss fiber, we want to say, let's increase that, right? We need more fruits in there. We need more nuts and seeds. And so fiber is important. I even recommend doubling that, 60 to 80. So due to the inherent variation of the Mediterranean diet, they suggest that more studies need to be done on to actually break down what that means in terms of Mediterranean diet and understanding its implications on health. So let's look at other studies. This is a landmark study called the Lion Heart Study. And, I'm talking about all these studies, right? Because I love sharing what the science says. And I also love sharing what I teach to medical students, even for fellow residents in training, and then my fellow physician colleagues. And so in these secondary prevention studies, so that means after they have disease, they're looking at what this type of diet does to them. So Mediterranean diet, it was studied, and how it reduces heart attacks, recurring heart attacks specifically. And the study participants were randomized to either controlled group diet or a Mediterranean style diet group. And then those studies, or those subjects particularly, noticed when they consumed the diet full of plant-based foods, it was 34% of their total calories was coming from, the fats. And you can have healthy monounsaturated fat, but it's the saturated fat that was high. While the Mediterranean diet had less of that saturated fat, less calories, but more fiber. What was happening? So that means this study served 4 or more servings a day of vegetables, 3 or more servings of fruits, 4 or more servings of grains. They did consume fats, oils, 4 tablespoons, which is kind of a lot. Imagine putting 4 tablespoons in your salad or frying things. I would definitely minimize that. Nuts and seeds, 3 or more servings each day. Beans and legumes, 3 or more servings each week. And then they did fish and seafood 2 to 3 times a week. Herbs and spices, they use that daily. They were doing yogurt, cheese, eggs daily to weekly, and they did have wine, 1 and 2 glasses of wine each day, and women 1 glass each day. So let's compare and contrast these findings. When we think about that Lion Heart study, you can see they did have people who had the Mediterranean diet did have less heart attacks, according to their studies. And we know that it also helps improve body weight. It decreased the risk for diabetes, which means insulin resistance, and then effects on dietary interventions on Mediterranean diets, even when it comes to vegetarian diets on hormones. So they were comparing and contrasting them. So even vegetarian diets, even without the dairy and the fish, had even a better, I would say, cardiovascular impact compared to the Mediterranean diet. So I just want to shed light to that once again, because we're not only thinking about inflammation and the most common diseases like diabetes, heart disease, and cancer. We want to look at the details. So there's been some studies in the UK for over 470,000 participants that categories the meat eaters versus the low meat eaters. So that means meat eaters had 5 servings of meat at least in 1 week. So they had it 5 times a week. The low meat eaters had it less than 5 times a week. The fish eaters and vegetarians, including the vegans, there was 446 of them. So they didn't have any meat and or fish at that time. And so during an average of 11 years, they followed their diseases. And they noticed that patients who had who were actually vegetarians and vegans, more plant-based, they had 12% lower risk of those diseases compared to regular meat eaters amongst men. And then low meat eaters and vegetarians were at lower risk of colorectal cancer. And so that's amazing. So there's a reduced colon cancer risk. And then when we think about the fish eaters, they did say that fish eaters did have a lower risk compared to the meat eaters. So there was a difference there. But it may not be statistically significant. And that's probably because, yes, they were eating fruits and vegetables, which is great, but still fish has some toxins like mercury, PCBs, and other things, which I do help in my own personal clinic at Dr. Lifestyle, how to identify those and how to properly get rid of those potential negative impacts on the immune system. And then amongst postmenopausal women, vegetarians had an 18% lower risk of developing breast cancer compared to meat eaters before eating or adjusting for BMI. So we can tell here that breast cancer is very deeply rooted to what we eat, not just colon cancer. And so we have to be mindful of what we eat. And even those patients who have a greater weights, more obese and overweight people struggle with breast cancer, but I've seen really thin, healthy ladies get breast cancer too in their 30s, 20s. So there are other factors that are driving the risk for cancer. Lastly, fish-eating men had 20% lower risk of prostate cancer, while vegetarians had a 31% lower risk compared to regular meat eaters. So definitely, once again, there is a big difference between those who eat meat frequently, who eat meat less, who solely eat their fish, and then of course who are more whole food plant-based. There is a difference. So let's look closely at these pyramids. The US pyramids have been changing so frequently, and even throughout the world, they all have a different view on nutrition. So that's why it can be very confusing and overwhelming. And I always say, what's the research? What's the funding? What's backing them up? Because nutrition and health is the foundation for health. And let's look at the left. So this is the Japanese Mediterranean food pyramid. For them, they would just be active every single day, move. And that was the foundation. That's very important for immune health and brain health. And then they would eat whole grains, either millets, but they did eat some rice noodles, some bread. You can see that they had a great amount of vegetables on a daily basis, legumes, nuts, and seeds, and fruits. And they had minimal vegetable oils. This was an optional thing if they could, one, have access and afford it, or two, it wasn't necessary. So they had fish, they had dairy, they had shrimp and other things that was optional. Weekly was eggs and poultry. And sweets, and then only once a month that they were having meat. The daily beverage here was basically tea or water. On the right, you can see a different pyramid. This is a more of a vegetarian pyramid, and you can see these are people in the blue zones, which I'll describe on the next slide. People felt socially connected. They were very peaceful people, meditated, had purpose, very connected to their family and their culture. They had high amounts. Look at that, big amounts of fruits and vegetables. It's almost 1/3 of the pyramid. And then they had um, a, another layer, about a quarter layer of their nuts and seeds and beans. And then you go up, I'm sorry if it's blurry for you. Then they have just a small amount of their oil. They drink water mostly, and then just a small amount of eggs and cheese and also yogurt. So let's look at this. So when it comes to plant-centric, plant-based nutrition, where did all this start? These started from centuries ago when people were eating more plant-based food. So this happened in my own training area, Loma Linda, but there's also, we call them the Adventist Health Community. They're all over the US and world. People in also Nicaragua, Costa Rica, Sardinia, Italy, and Greece and Japan, Okinawa, Japan. So back before the early studies, these people were living in their 90s to 100s. We call them centurions. They were living healthy, strong, vibrant, and with minimal medications and minimal use of chronic disease or even medical visits. And so what did they all have in common? You can see the green area. So they had purpose. They had this sense of peace. They definitely were, I'll go around clockwise. They practiced the 80-20 rule. So for them, they had 80% of their foods were either plant-based and then 20% more processed, like the cheese and the dairy and packaged foods, but mainly all plants. And then some of them had wine. Some of them also just knew that they needed to come together as a family, have activities together as a family, if that was hiking or moving about around the fields. And that is the beauty of why they lived so long. Now let's compare and contrast. So even Canada has just developed and embraced this more plant-based centric plates. You can see on the left, 50% of their food is some type of fruit or vegetable. That's amazing. Even sweet potatoes on there. Look at these beautiful, colorful nutrients. A quarter of it is whole grains, if it's type of bread, some noodle, quinoa, brown rice, and then your protein. Some people in America want their whole plate to be protein. That's all they eat. They want this low carb, high protein diet, but really it's all we need is a quarter of it. 93% of our population are over consuming protein. So we need to be very mindful. And so beans, nuts, and seeds are in our protein, and that's only a quarter. And then of course, the drink of choice is water. On the right is our plate that is 100% plant-based. So that's from American College of Lifestyle Medicine. And this is backed up by the American Diabetes Association, American Heart Association, Endocrinology, where they say plant-based foods, plant predominant foods are really what prevents chronic disease. And we can see 50% of the plate, once again, is fruits and vegetables. A quarter of it is your whole grains, and the other quarter is your plant proteins. But that's without the dairy. Once again, dairy is a place where we can find inflammation. So we gotta be careful. Those people have increased risk of asthma, acne, inflammation because of the casein whey. Fruits and vegetables. So fruits and vegetables are rich in vitamins, potassiums, and other minerals. It has carotenoids and flavonoids, fiber, and phytochemicals. These are the foundations of our health that fight off disease, like cancer. It fights off inflammation. It fights off even autoimmune disease. And these colors are the ones that decrease the risk from hypertension, osteoporosis, and stroke. And I love these. These are all tasty for me. I hope you can identify them and find them at your local grocery store. Cruciferous vegetables such as broccoli are important because they have something called isothiocyanates and indole 3 carbinol. These are things that fight cancer, right? These are nutrients that are anti-cancer. They are reported to be as effective to help even cervical dysplasia. So what does that mean? It helps. Cervical is actually, when you think about it, that's like pap smears. That's why people get pap smears, cervical cancer. So even at the cellular level, you're seeing changes. So broccoli, Brussels sprouts, cabbage, kale, cauliflower are excellent. And then onions may inhibit platelet aggregation and increase the risk of fibrinolytic activity. What does that mean? So onions can help prevent clotting, lower blood pressure, and this is what helps prevent strokes and heart attacks. Fruits and vegetables through tomatoes are great. There's something in it in itself that have helped to inhibit platelet aggregation and decrease the risk of type 2 diabetes, also lowers blood pressure with people with hypertension. And that substance is called lycopene. This, according to observational studies, can also prevent prostate cancer. So our men, unfortunately, are struggling with prostate cancer earlier, and it's great to identify that. Even if you have prostate cancer, it's a small organ, you can remove it, but at the same time, we want to reduce the risk of it happening again. Fruit and vegetables. Spinach, kale, and other dark leafy vegetables are a good source of lutein, which is a carotenoid that may help prevent age-related macular degeneration. What does that mean? That's a disease of our eyes. We all want to have good eyesight, to be able to see clearly, see far, and not necessarily want worsening prescriptions of your eyeglasses. And so we want to be careful. We also know that with the studies out there, spinach is a great source of fiber and antioxidants. I like to just add this. You definitely need a doctor to help you, or a plant-based nutritionist, someone that can guide you, because depending on your health condition, sometimes if you have high oxalates, you want to be careful because you may have the risk of having calcium oxalate kidney stones. But I would say that's not the huge factor in why people get kidney stones. It's usually because they're eating acidic foods all the time, which acidic foods are packaged foods like chips, crackers, junk food, and then also your animal products. Fruit and vegetables. So berries are a good source of anthocyanidins. So blueberries are amazing. They're rich in antioxidants, but that also enhances the capillary integrity and plays a role in visual function. So that means your capillaries are the ones that hold your blood, move your blood, and circulate it and filter the good and the bad, I would say, nutrients. And that goes to our lungs, it goes to our liver, and so it also goes into our eyes. There are little itty bitty vessels behind our eyes, but even our reproductive organs, and that plays a role in our vision and even our sexual function. And so cranberries contain compounds that inhibit the binding of pathogenic E. coli of our uroepithelial cells. What does that mean? So people, when they get UTIs, the first thing people want to do is get cranberry juice. It's not just that old tale or what our parents say. It's actually evidence-based. There is research that cranberry juice and cranberry extracts have been found to be effective for preventing UTIs. And I would say, of course, not all of them. It's not like, for example, some people need their antibiotic, and especially those who keep getting UTIs, and it's usually because their immune system is dysregulated. But wow, the power of cranberries is true and useful, and we can use food as medicine. Now, olives. Olives are rich in monounsaturated fatty acids, which are potentially cardioprotective because they can lower the LDL, which is the bad cholesterol, and are more resistant to be converted to atherogenic oxidized LDL. So if you ever come see me, I do order those specialized tests, and that allows us to understand, okay, the olives are great in its whole form, but maybe you can handle some olive oil or avocado oil, and how much can you handle? You'll learn this in my course, the details of how much and what specific foods are healthy for your certain health conditions. But of course, seeing me is best one-on-one. And then olives and extra virgin oil. Also contains a number of phenolic antioxidants. Look at these words. These are so amazing. Allopurin, hydrothiazole, phenolic acid, fibroacetate. These hard words to understand are the building blocks to having an anti-inflammatory effect and also cardioprotective effect. So that supports your autoimmune disease from getting worse, but also helps your heart health. And so when we think about that, don't completely avoid oil if you can use it based on your weight and health conditions. But I wouldn't consume every oil or overconsume those oils either, because the olive in the full form is best. Whole grains. So whole grains contain a wide range of vitamins and minerals, as well as fiber, essential fatty acids, protein, and antioxidants. Refining whole wheat to white flour depletes most of the fiber and results in substantial losses of vitamins, minerals, more than 75%. And of the thiamine, riboflavin, niacin, vitamin E, magnesium, potassium, iron, zinc, and magnesium. These things are lost when you refine them. So that's the difference between white bread and whole wheat bread, or white pasta and brown white pasta, is that you're really stripping out those healthy nutrients. Those nutrients people are craving because they actually want to get that from a supplement, and actually that's not the secret to healing. You need to have very guided supplement use, because you might be overindulging in those supplements and not knowing your levels, but also you can get these nutrients that can build your health through foods. And so when we look at whole grains, we definitely want to see that it has not only the fiber, it actually has some forms of calcium and things that support all aspects of our health, even thyroid. Beans and legumes. And so consuming beans and legumes such as edamame or red lentils has been shown to improve blood pressure, blood glucose, regulation, and to lower serum cholesterol levels. These have been proven. And there's a meta-analysis of 25 observational studies that found increasing consumption of legumes was associated with a decreased risk of heart disease. Isn't that wonderful? Beans are powerful. I always ask people to start with a bean that they like, because beans have calcium, it has protein, and then soy. Soy has been shown in some, but not all, to improve menopausal hot flashes and other menopause-related symptoms. So soy foods have demonstrated an effect on blood pressure. So don't worry about soy. Some people get overwhelmed about the studies out there because they think soy is bad and they have to be worried because they're going to get male breasts. And really that it's not what the case is. Soy is rich in protein, calcium, and antioxidants, and this can actually help prevent osteoporosis and some types of cancer. And so we look at the research and know that it's the whole picture that counts. There's large studies and big populations and cultures of the world that have been using soy for centuries, and they are just fine. There's not high risk of cancer for them or breast cancer. So nuts. Nuts are a good source of protein and essential fatty acids, magnesium, fiber, and consumption of various types of nuts have been shown to lower serum cholesterol levels. So you may have seen these nice cereals out there that they lower cholesterol. But be careful, right? Because those mainly have sugar and salt. So I always say raw, unsalted nuts. And then in observational studies, eating nuts was associated with a lower incidence of heart disease. And then since polyunsaturated fats in nuts can be oxidized to potentially lower those lipid peroxides, which are those unhealthy lipids, nuts should be stored in an airtight container in a refrigerator. So storage matters. I'm going to go again in the details of my course, because you want to eat them raw and unsalted. And if you are exposing them to moisture, they might be oxidized, you might expose them to mold, and that can be very toxic to your body. And then once again, but if you see a study like that, that doesn't mean avoid nuts, but really understand what that study is showing and better improve your storage or how you're consuming your nuts. There are some studies that roasting can potentially lead to some fatty acid issues and harmful oxidation products. So just like when people are frying their foods, grilling them, roasting them, um, of course, we love cooked foods, but if you are eating that mostly, you may not get the full effect compared to if you eat it raw. So let's look about plant-based nutrition. It's really the source and the foundation of being healthy and getting those whole health, right? I talked about the 5 tips of manifesting whole health. Here is one of them. Starting with plant-based nutrition. Whole foods, plant-based foods, fruits, vegetables, beans, nuts, and seeds are a great start, and avoiding animal-based products, dairy, and processed foods. So start off with a simple, small goal. If it's the first time you're meeting me, I'm always gentle and compassionate and patient because it's not like we can change this overnight. Some people do, but it can be a commitment, and it can be simple. It can start off maybe with a more Mediterranean plate, then transition to a plant-centric plate, introduce new foods, double up on your current fruits and vegetables, and then avoid those animal products. The second whole health tip is exercise. So, exercise is medicine. According to the CDC, 7 of the 10 most common chronic diseases are positively influenced by physical exercise. Can you imagine when we exercise, when we move, when we hike, when we get a little sweat, we can minimize our risk from disease. Sufficient physical activity could prevent 13% of breast cancer and colon cancer, 8% of diabetes, and can reduce the effect of heart disease by 7% as well, reduce that risk of 1 in 10 premature deaths. Physical exercises has shown to better manage kidney disease, sleep apnea, osteoarthritis, hypertension, heart disease, and type 2 diabetes and obesity. Looking at purposeful movement, we want to be able to encourage each other to walk, take the stairs, maybe do some cardio, little longer walks, endurance, hiking, and then strength building, have those small weights, and then routine exercise. Try to do things consistently. And then emotional well-being. So we know that we can be emotional. It's not just women, it's men. We all have emotions. And sometimes we can be very negative. Sometimes we can be overwhelmed, anxious. But things that can help is number one, just finding your sense of hope and positivity, having a good view about health and your body image, because it's not about perfection, it's really progress. And then taking time to breathe and have that stress management aspect to your daily routine. And doing things that are meaningful, that give you purpose. And once again, this all builds resilience. So, of course, our world is not perfect. There's always going to be a tragedy, something unpredictable. But when we have a good foundation of emotional well being, we can be more present and able to bounce back. So definitely stress impacts health. We know stress activates the sympathetic nervous system, cardiovascular responses, alters the gut function, and downregulates the immune system. And so this is called psychoneuroimmunology. Psychoimmunology is basically the brain, our emotions, our mental health, and our immune system are deeply connected. They are intertwined. It's like a spider web, right? If we think about our emotions, it's so connected, and sometimes we don't know why. But we do know from the evidence and science that stress can slow down wound healing. So these are the patients I see who get hospitalized because of skin infections or because they were diabetic. Just like my grandfather at an early age had to get an amputation and leading him to a diabetic food coma or coma from uncontrolled diabetes. And it's because extra stress can increase our sugar, slow down wound healing, and can really affect our choices. When we don't have that mental clarity, we are tend to have poor dietary choices. We end up stress eating, we become inactive, disordered, and poor sleep, and have this way of turning to substance to self-medicate. Stress management is important. We always need to be mindful because we can be present and think about what's in front of us. What can we be grateful for? If it's our loved ones, is it the sunshine? Is it the fresh air? Or just simply being alive? And then meditation. When we take time to frequently and consistently have the meditative way of relaxing. I'm not just talking about the nail salon and a facial. I'm talking really meditating, and also affirming, telling ourselves it's going to be okay. You're going to make it. You did a great job today. I don't think many of us praise each other. We end up praising our everyone else but ourselves. But we need to affirm ourselves. So I talked about nutrition was my first tip. I talk about exercise. Stress management was number 3, and number 4 is sleep. So sleep is vital for health and healing. So we want to watch out for this vicious cycle of poor sleep and disease. It works hand in hand. Once again, it's deeply connected. So the more difficult you have with your diet, you're struggling because you're eating tons of junk food, maybe soda, then you end up feeling more fatigue and lack that mental clarity. And that poor sleep increases the risk of obesity, heart disease, hypertension, type 2 diabetes, depression, anxiety, autoimmune disease, and even injuries. The reason why I say injuries is there's studies that show the most incidents. So people who are sleep deprived tend to get in more car accidents simply because they are unable to have good coordination and they just fall asleep too. So there is a bidirectional connection between sleep and illness. Restorative sleep is really important. How can we do that? Paying attention to our sleep hygiene, making sure that we're not missing any sleep disorders, and having a healthy routine. There are some things that overstimulate us, like caffeine. And then if our stress is not managed, we will definitely have poor sleep. The last tip, number 5, is sunshine. So being outdoors is amazing. We can go and do some forest bathing, hike, walking, meditate. Really take that deep breath and smell the flowers, smell the roses during springtime, summer, or just look around you. When you think about happy, healthy things, we feel better. And then there are studies such as the natural killer cells that gets released. So that's immune cells that kill off bad bacteria and viruses when we go outdoors. So people actually feel better when they're outdoors. And that's called ecotherapy. So get that frequent ecotherapy, find that thought and write it down if you're grateful and remind yourself over and over, because that elevates your mood, decreases chronic disease, and increases your vitamin D. So I'm Dr. Melissa Mondala. I work at Dr. Lifestyle Clinic, and I emphasize lifestyle and whole health. So let's start by L, right? L is love. This might be a picture moment just to help you remember. Sometimes we don't know how to love ourselves. We love other things or love people. We love the idea of something, but we forget to love our body, love ourselves. Our body is truly precious. It is something that houses our thoughts, our beliefs, and we can show that love that we might be missing, and maybe we've been deprived of love, but we can love ourselves and tell ourselves lovely, positive things. I is intention. So you just definitely want that intention. We need to set goals. So we need to be mindful. We need to be intuitive and have an intention to be healthier and have that healthy lifestyle. And then when you know that intention, which is your why, that can be the driving force of why you want to be healthier and happier. And F, of course, is food. We want to be mindful of what we eat. E is our environment. We want to be mindful of toxic substances, toxic people. And then S is sleep. Sleep, stress, and substances. Those are the things that are right in the meat of it all. We need sleep just as much as we need good food. So please don't neglect your sleep and find ways to de-stress. And then once again, get rid of those unhealthy substances. And then tea. This is one of my favorites that I spend a lot of time with my patients in my office to discuss. Sometimes we just need to trust the process. Take some time to appreciate the healing. A lot of us kind of know what to do with that direction we need to take, but we not only need the guidance, but just the healing of trusting and trying all over again, over and over. And that takes time. And then why is you. You're at the center of it. You're in the driver's seat. You have control of your health. You may have been told by your doctor you can't do anything else, that there's no medication, or you need a stronger medication. There's nothing that can be done. There's no test. It feels like a dead end, but really you are in the center. You can learn, you can change your lifestyle. And that's what I help people do. L is laughter. Take some time to laugh. Laugh with your friends and family. Tell some jokes. Watch some funny movies. And that is just relieving. You can laugh at yourself when you do things wrong. It's okay. It's not the end of the world. And then E is exercise. Exercise is, once again, healing and a place where we can learn to make that part of our routine. This is one of my favorite quotes from Benjamin Franklin. It's an ounce of prevention is worth a pound of cure. So the sooner you prevent things, even if it's one bite at a time, one step at a time, you can eventually avoid disease and find that cure. So I hope you enjoyed this talk, this webinar. Take some time to reflect when you are done with this, maybe tonight, and think about what steps are you making to reach these goals? What barriers are you stopping? What barriers are stopping you from achieving them? And what is motivating you to live a healthy lifestyle? Take a photo so you can understand what steps you want, what you need to overcome, and what motivates you. And here's the healing work. Pick your one mantra. My patients know that's what I do when I end my visits, because that mantra is a reminder. When you feel overwhelmed and stuck, you can think about what drives you and why you're doing it, and then visualize what you want to do with your health. What do you want to look like? Even, I'm not just talking about the superficial things, and it's okay if you want to be a smaller size of your pants. Like, go ahead, take a picture, remember those moments, and know that you can visualize your health in a way that defines whole health. Here are my references, tons of studies that back this up. And I just want to share this one slide because I do have a special promo. I know my Dr. Lifestyle patients, my members especially, will get $50 off of these courses, but this course is worth $1,000. And when you look at all the other courses out there, there's many courses not led by doctors giving nutritional advice. And I would say my course is backed up by science, so I love explaining them in a way where it's easy to understand. Instead of paying $1,000, you get to pay $97. Can you imagine? Instead of $1,000, it's $97, and that's 8 classes, and those are also free guides on recipes, meal plans. I'll be doing some group lives. We'll have some meditation classes. If you're a Dr. Lifestyle member with me, it's $47. So special promo. Sign up today. This promo is definitely not going to be there next time. Or just ask, right? Just ask, because we really want to provide the best health and not let the cost be an excuse for you. Everyone should have a chance to be healthy and learn about food and nutrition. That is my heart. And really, I have other courses out there. So please make sure you see your emails. I am definitely going to be sharing this my website, but literally you can look on my personal website, melissamondalamd.com, or Dr. Lifestyle to book an appointment with me. I will be having 3 courses. One course is the plant-based lifestyle. The other one is the total health reset, which is more on meditation, intuitive eating, meal planning, and you'll get more tips there. And the last one is a mental health course. And that's definitely very important, so you can catch depression, anxiety early on and be able to know what foods can overcome and prevent those symptoms. And if you need more tips, follow me on social media. I'm very active on Instagram, Facebook. Occasionally, I have my recipes on TikTok, and then my YouTube is starting back up. So, Dr. Melissa's Kitchen, and then my personal website where I have blogs. Feel free to sign up on my newsletters because I always release new content there for the studies and recipes. So thank you for your time. Thank you so much for showing up today, for giving yourself that chance to learn and heal and hear it. You might want to replay this and share it with a family member or friend. And then remember, self-care is the new healthcare. So when you take care of your health, when you start within, not necessarily starting from the outside, but the inside, deep emotions, deep thoughts, these decisions that you need to make, you will start to realize that's what healthcare is all about. Thank you for your time. Bye, everyone, and see you at the next free webinar. I'll be having these quarterly. See you at the courses and see you hopefully in my clinic.